Dr. Emily, Ms. Comm presented indeed a shocking example of something that happened in another state, Pennsylvania. And in the example she gave, she noted that in Pennsylvania, complaints were made. It sounds like public officials were asked to look into this. If complaints like this had been made in the Commonwealth, what's your assessment of how Virginia would have responded? And do you believe that you have the tools currently to effectively address an egregious situation like this if it's reported, as Ms. Cobb had suggested happened in Pennsylvania?
Certainly, the health department here, Virginia Department of Health, is currently not regulate these clinics, so we don't have any data and would not have the ability to evaluate situations like that. The Department of Health Professions does regulate the providers. So that question might be more appropriately turned to the Department of Health Professions.
Brief follow-up, Mr. Chairman. Commissioner Emily, I'm aware of cases in Northern Virginia where specific complaints have been made against specific clinics, and in the investigations, there was follow-up. State officials did go to the clinic to look into the complaints and follow through. And forgive me, I don't know whether it was the Department of Health or the Department of Health Professions, but I mean, is that something that you can speak to?
Sure. If we would receive a complaint, we would refer that complaint to the Department of Health Professions, because currently we don't have regulations to be able to investigate.
Okay, thank you.
Delegate Abbott.
Thank you, Mr. Chairman. I have a question for Ms. Cobb. I would ask, why are you not targeting physicians who perform sterilizations and vasectomies on an outpatient basis? Do you have any reason not to target them?
Well, abortion clinics, particularly because it's a politically motivated issue, have been sort of isolated from a lot of what we've done in other areas. And so that's why, in particular, they're being addressed by this legislation.
And I have a follow-up. If I could ask Ms. Cobb, have you ever been in an abortion clinic inside one? Because I have. And have you been inside urgent care clinics?
Like a patient first? Yeah.
That's right. Because
I've been initial question.
Yeah, I do a follow-up, sir. Because I've been in both types of clinic and where you would get other procedures and found them all to be clean and, as far as I know, safe and run by professionals. And I did have a question for Commissioner Rimley.
Can I just follow up with that? I would just say that if you haven't been in all the abortion clinics, we don't know that they are all this way. There was a similar situation in New Jersey this past year. So it's Pennsylvania, New Jersey, and other places. We just need to know.
Okay.
And Dr. Ridley.
Thank you, Chairman. If I could ask Commissioner Rimley, is it true that first trimester abortions, which are commonly performed in physicians' offices, not in hospitals or outpatient centers, are considered the safest of all abortion procedures? In other words, in the absence of hospital-like regulations, it's my understanding that first trimester abortions already are the safest of all abortion procedures in the Commonwealth and nationwide. Do you have any evidence that's otherwise in Virginia? Or?
I don't have data here today to address the difference in safety in different. We haven't looked at that specifically. Pardon?
Well, we could. Thank you, Mr. Chairman.
Delegate Morris here.
Thank you, Mr. Chairman. For Ms. Cobb, please. Ms. Cobb, I would preface my question with the following remark, that not only am I inclined to support this bill, but I voted for it in the past. But I'll say this, I'm not at all impressed with this incident that you shared with us from Pennsylvania and New Jersey, the zealousness in which you've done it. I don't think adds and helps the situation at all. My question is are you familiar with a single instance in the Commonwealth of Virginia where you had an egregious, horrific example that you previously described?
Yeah, there was a woman who died in Northern Virginia. I think that's what was being referenced there by misuse of anesthesia. There's also been instances where we've had doctors. You can go through the files. These are public. When the doctor gets reprimanded, that's a public file. There have also been instances where, because an ultrasound was not used, the fetus was basically, the guess of the age of the fetus was wrong, causing the abortion doctor to go in and do a procedure incorrectly because he thought it was an earlier term fetus than it was.
That information is helpful. Thank you. Mr. Chairman, one question for Commissioner Remley. Good morning. With respect to this particular bill, is there going to be similar legislation for similar rules and regulations and regarding outpatient ambulatory health clinics for doctors' offices that perform things like a colonoscopy or a facelift where the face is peeled back? Also, two very significant types of invasive surgery. Will we be expanding this? Because what's important to me is that we treat everybody fairly. Take a great deal of personal umbrage when one individual or one entity is separated and set different standards for that particular person, or in this particular case, procedure.
Respectfully, sir, Delegate Bell's bill as written does not include those other areas.
Should it?
That's not a question, because this is a legislative decision right now. What I can tell you is, if we don't regulate, we don't have information to know safety and quality. That's occurs through Department of Health Professions, the specific provider-specific information. So the different types of procedures you're talking about are regulated, and the safety and quality measure that the state gets involved in happens through the Department of Health Professions currently.
Follow-up question, Mr. Chairman.
Delegate Morris.
Just so that I'm clear, you are in favor of regulating these abortion clinics, correct? My question then is, are you also in favor of regulating the doctor's offices that do the same type of invasive surgery?
I think it's a very important issue that we are looking at carefully to see what data is out there, to see which of these procedures, which of these things need to have further regulation.
Follow-up question, Mr. Chairman.
Delegate Morris.
Insofar as those doctor's offices that have outpatient ambulatory surgical procedures and have invasive surgery similar to what is going on in abortion clinics, do you think, I'm asking you, that those also should be regulated?
As Commissioner, what I can tell you is right now, and I think Dr. O'Bannon helped put this legislation through, we're looking at a number of those outpatient procedures.
In all due respect, Mr. Commissioner, Mr. Chairman.
But to Delegate Morris, I guess, I think our questions need to be focused on the legislation before us. If you're suggesting whether, she thinks there should be an amendment, I think she's answered, she's not going to be doing that to members.
No, Mr. Chairman, I'm not asking if I appreciate that, if there should be an amendment. What I want to know, and part of the way I'm going to vote on this bill, is to make sure that we have consistent treatment to all different types of doctor's offices. Now, I know you're looking into it, because I know that because you told me 3 times. I want to know if you're in favor of regulating an outpatient ambulatory doctor's office that also performs invasive surgery. I'm not interested in looking into it. I want to know if you're in favor of it.
Right now, I say I don't have an answer to that question because I don't have enough data.
Thank you, Mr. Chairman.
I have Delegate England next in the queue. Is anyone else to ask a question since he's already asked? Okay, Delegate England.
Sorry, Mr. Chairman, this is for Ms. Cobb. Ms. Cobb, I appreciated in one of your responses earlier your acknowledgement that this is a highly political issue all around. And so I'm just curious to know, I've got some data from the American Medical Association that shows that the complication rate for abortion is 0.3% compared to 1.7% for tonsillectomies, 1 to 5% for breast augmentation, 0.4% to 3.5% for LASIK surgery, and in LASIK, 10% of those patients also need additional treatment. So abortion is safer than any of these fairly common procedures that happen in doctors' offices that are subject to the same rules and regulations that abortion providers are currently subject to. Then why is there no group before us every year trying to ban, or I should say regulate, tonsillectomies or breast augmentations or LASIK surgery?
I'll be really honest with you. I think most Virginians want to know when they walk into any of these places that they are regulated and safe, whether you're getting a tonsillectomy or you're getting an abortion. And I will tell you that women in particular, if they walk into an abortion clinic and know that they have the chance of walking out and never being able to have a child again because their uterus has been perforated, they really, really want to know that it's been regulated and that when they've made this choice, that it's now legal and it is actually safe. That's what they want to know.
Further questions, Mr. Chairman?
Yes, sir. Delegate.
Well, Mr. Chairman, I just also want to note to Ms. Cobb, this is a perennial issue, obviously, that we've all dealt with, and my one regret this year is that I don't get to spar with my good friend Matt Lohr over this issue. But I guess my question is, I mean, given your concern about safety overall that you just expressed, I mean, can we expect the Family Foundation to be putting forward legislation next year on tonsillectomies and breast augmentation and LASIK surgery?
So it's generally not our scope, but I will tell you that if doctors were being arrested in those fields for murders, and if there were complaints at this level, you'd see outrage from groups that are involved with that particular issue. They'd be lining up here asking for regulation.